What if secret warning signs of serious liver disease were hiding right under your nose in your skin and nails, yet you never noticed? Fatty liver disease affects an increasing number of older adults, especially those over 60. The frightening truth is many remain unaware until significant damage has occurred. One of the first places your body sends subtle signals is through changes in your skin and nails. Hi, I'm from Golden Aging Health, and today I'll reveal the top 5 early warning signs of fatty liver disease that show up on your skin and nails. Yes, your body could be quietly sending you important signals, and recognizing them early could help you prevent fatty liver, avoid liver failure, and even save your life. Tap the like button, subscribe for more tips on senior health and healthy aging, and make sure to watch until the end, because I'll reveal a surprising nail sign that doctors often miss. Sign number 1. Yellowing of the skin and eyes. Jaundice. One of the most obvious and visible early signs of fatty liver disease is a yellowish tinge to your skin and the whites of your eyes. This is called jaundice, and it happens when your liver isn't working properly, so it can't break down a substance called bilirubin. Instead of being flushed out, this waste product builds up in your body, causing your skin and eyes to turn yellow. You might also notice dark urine or pale stools along with it. In fatty liver disease, excess fat in liver cells causes inflammation and reduces the liver's ability to remove bilirubin from the bloodstream. As a result, bilirubin builds up and causes this yellow coloring. Since jaundice often begins subtly in seniors, it can easily be overlooked. Early yellowing may appear on your face, neck, or in the whites of your eyes, which might lose their usual brightness. According to Mayo Clinic, jaundice is a critical warning sign of liver dysfunction that requires immediate medical attention. If you or a loved one sees this yellowing, it's important to consult your healthcare provider promptly. My neighbor, Mr. Bill, 68, thinks he just looks a little tanned in the summer, but his wife noticed the whites of his eyes were turning yellow. They went to the doctor, and sure enough, he had early-stage fatty liver disease. Thanks to that early visit, he was able to start treatment before it got worse. It's often painless, which makes it easy to ignore. But if you or someone you love suddenly sees yellowing in the eyes or skin, please don't wait. This is your body raising a red flag, and it's time to speak with your doctor immediately. Because when it comes to the liver, early detection is everything, and this sign is too big to overlook. Sign number 2. Itchy skin. Besides yellowing, persistent itchy skin is another important warning sign of fatty liver disease. This itch differs from that caused by dry skin or allergies. It's a persistent, deep sensation often affecting arms, back, or legs with no visible rash, redness, or bumps. I once read in a magazine about the case of Mary, who at age 67 thought her constant scratching of her arms was just dry skin due to aging. It's actually a warning sign of fatty liver disease. The Mayo Clinic reports that 20% of people with symptoms of fatty liver disease experience itching due to bile salts irritating the skin. A fatty liver struggles to process bile, causing the salts to build up under the skin, causing itching. Persistent itching may signal fatty liver disease and skin issues before other symptoms emerge, explains Dr. Naga Chalasani, a liver specialist at Indiana University. If you experience this sensation without a rash, especially at night, it's a sign to check your liver health. Understanding the root cause of persistent itching is key, and later, we'll discuss how to address it while taking care of your liver health. So, the next time your skin itches for no reason, don't just brush it off. It could be your liver gently tapping you on the shoulder, asking for help. Have you ever struggled with this unexplained itch? Drop yes if you have and share your experience. Sign number 3. Nail changes. Terry's nails and clubbing. Did you know your nails could hold the key to detecting fatty liver disease? These subtle changes might be warning signs you can't afford to ignore. If you notice your nails turning pale, white, especially near the base near the cuticle, it could be an early sign of fatty liver disease symptoms. This condition is often referred to as tarry nails, a common symptom seen in people with chronic liver problems, including cirrhosis, the final stage of fatty liver disease. As promised in the previous section, this is the nail color change I mentioned that can signal early liver dysfunction. Now, I'll explain exactly why this happens. According to Harvard Health, when the liver starts to malfunction, it affects protein production and blood flow beneath the nails. The result? That healthy pink color fades, and your nails may appear white, with a darker rim near the tip. According to a 2022 review, up to 80% of patients with advanced liver disease develop nail changes, including pale or white discoloration. While this is more common in severe cases, these signs can appear early, and that's your chance. One of our viewers, John, 72, commented last month that he noticed his nails turning pale but didn't think much of it. When he mentioned it during a routine checkup, his doctor ran liver tests and discovered NAFLD before the disease progressed. He adjusted his diet and started taking light walks every day, and 3 months later, his liver enzymes were back to normal. Sometimes, the quietest changes in our nails can whisper the loudest messages about our health. It's a small thing to notice, but it might make a big difference. Your nails acting strangely. Don't keep it to yourself. Share what you've seen in the comments, and let's figure out the next best steps together. Sign number 4. Spider-like blood vessels on the skin. Spider angiomas. You might have noticed small reddish spots with tiny blood vessels spreading out like spider legs on someone's face or neck. These are called spider angiomas. While a few of these spots can be harmless, their appearance can sometimes signal an underlying health issue. Building on the skin changes we've already discussed, another subtle yet important symptom of fatty liver disease to watch for is the appearance of these spider-like blood vessels, medically known as spider angiomas. These are small, reddish spots with tiny blood vessels radiating outward like spider legs, often found on the face, neck, chest, or arms. These spots appear when fatty liver disease disrupts hormone balance and blood flow, causing small vessels near the skin's surface to dilate and become visible. They are particularly common in older adults experiencing liver inflammation or early cirrhosis. Harvard Health notes that the presence of multiple spider angiomas, especially if they increase in number or size, can be a clear sign of liver dysfunction that needs medical evaluation. Spider angiomas are particularly common in people with liver disease, when the liver cannot properly process estrogen. This hormone imbalance leads to the widening of blood vessels, creating these spider-like patterns. Having 1 or 2 of these spots can be normal, even healthy people can have them. But if you notice several, especially if they increase over time, it could be your liver signaling a warning. If this sounds familiar or raises any concerns, drop a comment below. Your questions or stories might help someone else stay informed. Sign number 5. Dark patches on the neck, underarms, or groin. Another important fatty liver disease symptom to watch for is the appearance of dark, thickened patches of skin, medically known as Acanthosis nigricans. These patches often develop on the neck, underarms, or groin, and may feel velvety or rough to the touch. This condition is called Acanthosis nigricans, and while it might not seem serious on its own, it can actually be an early sign of fatty liver disease, particularly in people with insulin resistance, which is common as we age. According to the National Institute on Aging, insulin resistance not only increases your risk of type 2 diabetes, but it's also a major contributor to non-alcoholic fatty liver disease, NAFLD. When your body resists insulin, the liver stores more fat, leading to liver inflammation and damage. So, what's the connection to your skin? High insulin levels stimulate skin cells to grow rapidly, causing thick, darkened areas often described as dirty-looking skin that doesn't come off with washing. In fact, a study published in the Journal of the American Geriatric Society found that over 60% of seniors with Acanthosis nigricans were later diagnosed with either type 2 diabetes or NAFLD. That's a significant overlap. Now that we've covered the key early signs on your skin and nails, let's explore some science-backed ways to support your liver health and improve these symptoms naturally. Science-backed ways to support your liver and your skin and nails. Having reviewed the main early signs visible on skin and nails, let's now look at science-backed ways to naturally support your liver health and ease these symptoms. 1. Adopt a Mediterranean-style diet, rich in healthy fats, fiber, and antioxidants. Studies from the Harvard T.H. Chan School of Public Health shows it can reduce liver fat by up to 30% in seniors with NAFLD. 2. Limit sugar and refined carbs. Research from the American Liver Foundation links high fructose diets to increased liver fat and inflammation. 3. Take 30 minutes of light activity daily. A study published in the Journal of the American Geriatric Society found that moderate walking 5 times a week helped lower ALT levels, a key liver enzyme, in people over 60. 4. Supplement wisely. Talk to your doctor about vitamin E, zinc, and omega-3s, which have shown benefits in improving liver function and skin tone in fatty liver patients, according to Mayo Clinic and NIH studies. 5. Stay hydrated. Proper hydration supports detoxification and skin elasticity, especially for aging adults whose thirst signals may weaken. 6. Get regular blood tests, including liver function tests and nutrient panels, which can catch subtle imbalances before symptoms appear. To sum it all up, paying close attention to changes in your skin and nails like yellowing, itching, spider angiomas, dark patches, and nail abnormalities can provide early clues to fatty liver disease. Early detection empowers you to take action before the condition worsens. You don't have to feel overwhelmed. Start small. Maybe today, it's just drinking more water. Tomorrow, add 1 veggie to your lunch. Bit by bit, you'll be giving your liver the love and care it deserves. Your body is constantly communicating with you. Don't ignore these subtle signals. Taking charge early not only helps your liver but supports your journey to healthy aging. For more tips and detailed guidance, be sure to check out our playlist on liver, lung, and kidney health. A great resource to help you stay informed and proactive about your well-being. If this video helped you, tap like and subscribe to Golden Aging Health. Your support enables us to share trusted, easy-to-understand health tips with more seniors. Before you go, have you or a loved one noticed any of these signs? Share your experiences in the comments. Together, we can support and learn from each other. Stay healthy, stay strong, and see you in the next video.